Analysis of the method of urinary drainage in spinal cord injuries at the acute phase of the trauma from 2013 to 2018 at your institution, course of care on morbidity. Spinal cord injury patients require bladder drainage due to neurological bladder dysfunction. International scientific societies recommend early implementation of intermittent catheterization to limit urological complications, preserve the fertility, preserve the urological function, and improve the quality of life of spinal cord injury patients. The objective of your study was to analyze the consequences of different types of bladder drainage in spinal cord injury patients during the acute phase of trauma. We respectively analyzed the types of bladder drainage in spinal cord injury patients with bladder sphincter disorders in the acute phase of trauma at your institution. Data collected were the length of hospitalization, the drainage method used, early complications, type of discharge from the hospital, urine culture results, and the use of antibiotic therapy. Our study was descriptive and observational, supplemented by a univariate study in order to know the impact of professional practices on morbidity, specifically on infectious morbidity. The care pathway of 81 patients was analyzed. All of them had an indwelling catheter, and among them, 56 benefited from IC. The patients who left the hospital with an indwelling catheter after being treated in the resuscitation, orthopedic and resuscitation, then orthopedic department were 25.5%, 87.5%, and 90.3% respectively. Taking all care pathways altogether, 63% of patients left the hospital with an indwelling catheter. Among these patients who were managed in intensive care unit and then in orthopedic unit, 80% of patients who had IC in intensive care unit had an indwelling catheter in orthopedic unit. Patients with at least one event on indwelling catheter on IC were respectively 40.7% and 24.4%. In more than 80% of the cases, there was no urological cause for maintaining or restoring indwelling catheter. 169 urine cultures were performed in your population. 27% had antibiotic treatment for urinary causes, of which 22 left the hospital with indwelling catheter. Indwelling catheter was significantly associated with a higher risk of febrile, non-febrile infection and antibiotic use. A duration of exposure greater to 30 days of indwelling catheter was significantly associated with a risk of febrile, non-febrile infection and antibiotic use. Early implementation of IC is not always initiated despite recommendation. This has a direct impact on the morbidity of patients with spinal cord injury from the acute phase of the trauma. Results from this study represent the rationale of the research study that will promote IC as the main bladder drainage in spinal cord injury patients in your institution.